Hello, my name's Dr. Hazel Roddam. I'm a speech and language therapist. I worked for 25 years in clinical practice. I worked with children with motor movement difficulties and learning disabilities, and I loved my work. I had a range of clinical roles working in health and in education sectors in UK. And then in 2006 I made a change. I went to work at a university in the northwest of England. The university is called the University of Central Lancashire. It is based in Preston, and we don't teach speech and language therapy there. I went to join the research unit, which is the Allied Health Research Unit. We have teaching programs in physiotherapy, but for master's level and doctoral level, we have a wide range of allied health professions, including speech and language therapists. So much of my role there at this unit is to supervise the PhD, the doctoral level study, for clinical research projects. The focus is on what works, what makes a difference in clinical practice for people who receive our services and for us as healthcare professionals delivering those services. So my role is to work with clinical therapists and the teams in their place of work to help them to design research projects to show the effectiveness of their new ways of working. Speech and language therapists in particular are creative, dynamic people who have developed really effective ways of working, but they need to be able to find ways that they can demonstrate that this is the best way for their patients. Okay, so what is this module all about? The module topic is evidence-based practice. It's going to cover understanding what does evidence-based practice mean, but most importantly, how can you use this in your practice every day where you work? Evidence-based practice is a phrase that people have been talking about for more than 20 years. And many people use it without really understanding or being able to explain what does it mean in real life. In 2010, I published a book. This was not all my writing. It was a compilation of chapters from speech and language therapists all around the world. We had 24 contribution chapters, and people were asked to describe what does evidence-based practice mean to you and how do you put this into your own daily routine. We had wonderful contributions from all around the EU, from United States, from Australia, of people in a very collegial fashion explaining to another professional, this is how I work and you could do it too. So to understand what does evidence-based practice mean, how do I do it? What skills do I need? What support do I need? And where can I access that support? These are all the topics that will be covered in the module. The blended learning aspect gives you the opportunity to develop a portfolio of your own, to keep resources and information that will be useful to you in your work, but at the same time to meet other interested speech and language therapists from around the country, to talk with them and to understand how they are on this journey too, and to help each other. We look forward to working with you in this. We hope you will choose this module. So why might you be interested to do this module? The thing about evidence-based practice is it is essential whatever your field of work. If you work with children or you work with older people, you work with people who have a developmental problem or who have an acquired problem, an illness or an accident, head injury maybe, or cancer. Whoever you work with, when you go home at night, you think to yourself, was that the best way to work with my patient? Is there a different way to work that would be better for them? How confident can I feel that I know all the information about the different treatment choices? This is what evidence-based practice will help us to answer. It gives us the confidence and the skills to be able to know that we are practicing in the best way possible. This is a quality issue. So we are driven by our own professionalism to want to answer these questions, to want to be the best therapist that we can. but it's also a political agenda. The people who employ us, so our organisation where we work, and the government want to be sure that if someone goes for speech therapy in one city, they should have received the same treatment that they would in another city, in a different part of the world. This is our collective professionalism and our collective research evidence base for practice. So we should be able to show that we can keep ourselves up to date with this research evidence base, and that we can apply this where it matches our patients' needs and their interests. So this is how evidence-based practice works. It is a quality agenda and it has a political agenda. The government need to ensure that the care that we all deliver is the best quality care, so clinical effectiveness, but it is also cost effective. It is the best value for money. So these are the drivers that we need to understand. This is the context in which we work, and this is why we need to be able to be confident in our evidence-based practice approach. When you read about evidence-based practice, it is overly simplistic. It gives the impression that it is easy to just stop in the middle of your clinical work, to run to the library at the hospital to find some research, and then go back to your patient and carry on with the evidence-based practice approach. This isn't possible, so how can you do it? This is what we will explore in the module. We will look at strategies that have been implemented in many countries to support the use of research in clinical practice, and we will look at case examples of how do other speech and language therapists manage to achieve evidence-based practice every day in their routine. There are ways that we can learn from other people, from other services and other organisations, and this is what the module will allow. We will be able to reflect on what are the responsibilities for each individual therapist, but what are the responsibilities for the organisation where you work to help to support you to achieve evidence-based practice? And at the same time, what is the responsibility for the professional association to support you to be able to continue development and learning throughout your professional career? So what's special about this module on evidence-based practice? What is different about this? There are many online tutorials, many textbooks about evidence-based practice, including some which are directly written for speech and language therapy. But it's one thing to understand the theory about what are the traditional definitions of evidence-based practice, but what you really need to know is, how can I make this work for me? How can I change the way I work in my hospital, in my clinic, in my school? How can I be confident that I am changing to be more evidence-based practice? So what this module will give you, it will give you comprehensive understanding of the traditional definitions of evidence-based practice, and it will give you many insights into examples and exciting different ways to practice from speech and language therapists around the world. But it will also give you the opportunity to meet and work together with colleagues in your own country, so you will have a supportive peer group who are on this learning journey with you. You have the opportunity in the blended learning sessions to be able to meet face to face, to keep in contact with the mentor, with each other as students, to be able to help each other to support your learning. At the end of the day, you will have a lot of new information, a lot of new skills and confidence. So you will improve the quality of the care that you offer, but more than that, you will return to your workplace as an evidence-based practice champion. You will influence other people by the way that you change your practice and the way that you talk about evidence-based practice, and you will help to spread the word, to help other people to understand why evidence-based practice is important and why it doesn't need to be frightening or complex. It is achievable, it is realistic, and it is essential. So we look forward to working with you. Viel Spaß im Modul. Vielen Dank.